Hi, my name is Jackie, and the mineral that I chose to research was potassium. Potassium is a soft silvery white metal with a melting point of 63 degrees Celsius and a boiling point of 770 degrees Celsius. Its density is less than that of water, which means that potassium metal can float on water. Potassium forms many important compounds. We have potassium chloride, and it is the most common potassium compound, and it is used in things such as fertilizers and as salt substitute to produce other chemicals that we well know here in Idaho as ice melt and snow melt. And then we have potassium hydroxide, and it's used to make very familiar things such as soap, detergents, and drain cleaners. Potassium was the first element metal to be found through electrolysis. Potassium is found in red blood cells, muscles, and bones. Potassium is a mineral and an electrolyte in the body. Actually, it is considered an electrolyte because it carries a tiny electrical charge. Almost 98% of potassium is found inside the cells. It is fat soluble. Small changes in the level of potassium that is present outside the cells can have severe side effects on the heart, the nerves, and muscles. Potassium is an important mineral in the body and plays roles at both a cellular and an electrical level. Now, as mentioned, potassium is a mineral in your cells. It helps your nerves and muscles work as they should. The right balance of potassium also keeps your heart beating at a steady rate. And as many of you know, high blood pressure is a major risk factor for stroke and heart disease. However, having potassium in the diet actually lowers blood pressure, which is beneficial to the heart. And then we have two other things that I wanted to touch on. We have hypokalemia or hyperkalemia. I'm actually not sure how it's pronounced, but basically it's a decreased potassium in your body, and that can arise due to kidney disease. Which signs would be excessive losses due to heavy sweating, vomiting, diarrhea, maybe an eating disorder, or even consuming certain medications. Research led by F.J. Hattie theorized that potassium supplementation could help reduce complications such as stroke. Now, further research is required, but the study showed that infusions of potassium would cause an increase in blood flow, which definitely benefits the brain, as well as dietary supplementation with potassium that could help lower blood pressure. And then potassium has two really important relationships to calcium and sodium. The role that potassium plays is based on a complex interaction between concentrations of potassium, sodium, and calcium within the bones. If you lack calcium in your dietary intake, your body may pull calcium from the bones. And then we have sodium and potassium balance in your body is actually really sensitive. And according to Dr. Lawrence Wilson, who is a medical doctor and nutritional consultant, an imbalance in this ratio can contribute to the development of seizures, such as epilepsy. So this imbalance can trigger a tissue breakdown at a neurological level, but a correction can help to produce an improvement in those seizures. So then we have our food sources. We have low potassium foods, which would be anywhere, it would be less than 100 milligrams. And then we have our high potassium foods, which would be over 300 milligrams. And then I have a nice list there, and it includes many fruits and vegetables such as spinach, parsley, broccoli, tomatoes, oranges, orange juice. And then here is our chemical structure of potassium. Thanks for listening to my presentation on potassium. My references include WebMD and Livestrong.